Welcome to The Explainer. Today, we're getting into something we all know, but is still so personal: pain. We're going to look at how it's managed and really dig into the role of opioids, a powerful and, let's be honest, often misunderstood tool.
So that's the big question, right? Everyone feels pain, but treating it? Man, that is not simple. It's actually a super complex journey full of tough choices and real challenges. And that's exactly what we're going to unpack today.
All right, so here's how we're going to break it all down. We'll start with acute pain, then get into the tricky world of chronic pain. After that, we'll look at pain in cancer care and in palliative care. And we'll finish up with some really important guidelines for prescribing safely.
Okay, let's dive right in. We're starting with acute pain. You can think of this as your body's built-in alarm system. It's a loud, clear signal saying, hey, something's wrong here. Pay attention.
So what makes it acute? Well, two things really. First, it's temporary. It doesn't stick around forever. And second, there's usually a really obvious cause. You break a bone, you have surgery, you twist your ankle, that kind of thing. The pain is there for a reason, to protect you, and it's supposed to go away as you heal.
Now, how you treat it really depends on how bad it is. It's not a one-size-fits-all deal. If it's pretty mild, something like paracetamol or an NSAID, a non-steroidal anti-inflammatory, is usually enough. But when you're talking about moderate to severe pain, like after a big operation, that's where opioids can be a total game changer for short-term relief, just to get you through that initial recovery period. Okay, so that's acute pain. But what happens when that alarm system I mentioned just refuses to turn off? Well, that's when we get into something much, much trickier: chronic pain.
The magic number here, so to speak, is 3 months. If pain sticks around for longer than that, it's not just a symptom anymore. It's become a condition all on its own, one that can completely change a person's life.
And get this isn't some rare thing. We're talking about a huge number of people. In the UK, it's thought to be around 40% of the population. That is staggering. And it has this massive ripple effect, not just on people's lives, but on the whole healthcare system, even the economy.
Okay, so chronic pain isn't all the same either. There's a really important difference to understand. Sometimes the pain is the problem. That's primary chronic pain. We don't really know what's causing it. But other times, it's a symptom of something else, like arthritis. That's secondary chronic pain. And figuring out which one you're dealing with, that's absolutely key to treating it right.
Because it's so complex, you can't just throw one thing at it. You need a whole toolbox, a holistic approach. We're talking about a mix of things. Sure, medication, but also non-drug therapies like acupuncture. And really importantly, psychological support. Things like cognitive behavioral therapy, CBT, can be a huge help in learning how to cope.
And this is where we hit a really critical point when it comes to opioids. For chronic pain, it gets complicated. You see, if you take them for more than 3 months, the risk of dependence and tolerance, that's when you need more and more to get the same relief, goes way up. And that's a major, major concern.
All right, let's shift gears now and talk about a specific and often very difficult area: pain and cancer care. Here, the rules of the game can change quite a bit.
Just look at these numbers. Pain is a huge, huge part of the picture for people with advanced cancer. We're talking up to 2 out of every 3 people. And for a lot of them, strong opioids aren't just an option. They're absolutely essential to have any kind of quality of life.
What makes cancer pain so complex is that it can come from all over the place. It could be from the tumor itself, from treatments like surgery or chemo, or from other conditions caused by the cancer. So you often have people dealing with both that short-term acute pain and long-term chronic pain all at once.
And here's an interesting twist. The good news is the cancer treatments are getting better and people are living longer. But that creates a new challenge. They might need pain relief for a lot longer, too. And that brings us right back to those issues of tolerance and dependence we talked about earlier.
This is why it's so important to have these conversations early on, to be proactive about it. The goal isn't to avoid opioids, not at all. It's about having a smart plan from the get-go that finds that sweet spot between really good pain relief and keeping the patient safe.
Okay, moving on to our next section. Let's talk about palliative care. This is where the whole focus of pain management shifts in a really fundamental way. It becomes all about comfort and quality of life. So when we talk about palliative care, the #1 goal is simple: make the person as comfortable as possible. It's all about finding that perfect balance between getting the pain under control and making sure the side effects from the medication are manageable.
And how do we do that? Well, it's a team effort. and it's totally centered around the patient. You've got regular check-ins, and you're using a mix of drug and non-drug options. You'll even see adjuvants being used. Those are drugs like certain antidepressants that aren't technically painkillers, but can be amazing for specific types of pain, like nerve pain. Really, it's about using every tool in the book to improve comfort.
And here's a really good example of a specific evidence-based strategy from NICE. That's the UK's National Institute for Health and Care Excellence. The go-to is often morphine for that regular background pain. But then you also have immediate release doses ready for what's called breakthrough pain, those sudden nasty flare-ups that can happen.
Okay, we've covered a lot of ground. So for our final section, let's pull it all together and look at some key guidelines for safe prescribing. These are the big takeaways, the principles that apply no matter what kind of pain we're talking about, and they're absolutely vital for using these powerful drugs responsibly.
It really boils down to these 4 key principles. 1. Start low. Always use the lowest dose that actually works. 2. Go for the oral route whenever you can. 3. Stick with immediate release versions at first, not the long-acting ones, so you can see what's really needed. And 4, and this one is so important, always have an exit strategy, a plan to taper down and stop the treatment once the pain is gone. These drugs are not meant to be a forever thing unless it's absolutely unavoidable.
And that brings us full circle, right back to that fundamental question. How do we get people the pain relief they desperately need, while also keeping them safe? You know, there isn't a simple, one-size-fits-all answer. It's a constant balancing act, a conversation that has to happen between doctors, patients, and their families every single day.